So this is my second passion, apart from asthma, is DKA, and I was privileged to work with Bill and Julie Edge, both of whom have retired. I'm very jealous because I've still got a few years to go. Now, 20 years ago, I looked after a 2-year-old in intensive care, following the national guidelines that were there at the time, and the child died from cerebral edema, and I thought, this is wrong. Something's wrong with the national guideline. And it's great to see that after 20 years, we've managed to sit around a table and put through the nice guidelines. And I'm just going to go through the 4 simple rules. And if you do these 4 simple rules, you should not die from DKA. So I agree entirely with Bill. We should not have deaths from DKA. Now, this is DKA in intensive care in UK. This is 10 years, so I'm privileged to get all the data for this. 1,000 admissions in 10 years for DKA into PICU. I mean, it's crazy. 1,000 cases for a preventable condition. And you can see there, most are female, but we had 9 deaths. And this is, as the years have gone by, you can see the admissions to PICU have gone up. And then around about 2010 to 11, there was a concerted effort with guidelines to try and unify them, and the admission rate dropped. I mean, this is quite a trend because this is the whole of UK. We're seeing the number of admissions falling, and I think that's because care has got better at all the hospitals. And we had no deaths, although I can say we've had 1 or 2 subsequent to that. Now, the deaths happen at any time and at any age, and you can see here patients with DKA of 1 year, 10 years, 15 years. Adolescents can die from cerebral edema, so they are not small adults. And you can see here, you can die at any time.